From a helipad to a dedicated neuro-intensive care unit, Overlook Medical Center in Summit, New Jersey is a leading provider of neurosciences care. Its highly specialized neuroscience team is delivering cutting-edge, life-saving treatments to tri-state area patients.
In the United States, according to the SEBA Trust, which is the Central Brain Tumor Registry of the United States, there will be 80,000 new cases of brain tumors this year.
CAT scan and MRI are diagnostic tools that can help identify a brain tumor.
In terms of advances, we've seen it in every area. The diagnosis, the ability to detect these earlier when they're smaller because of the advanced MRI techniques. Surgical techniques have really improved.
Symptoms of a brain tumor can include headaches, changes in cognitive function, balance problems, stroke-like symptoms, sudden numbness, weakness, clumsiness. There are several different types of brain tumors, all requiring different treatment approaches and protocols.
Brain tumor is an abnormal growth that occurs within the brain itself. These can come in two different forms, benign and malignant forms. Those that start in the brain we call primary brain tumors, and then the other kind are the kinds that spread from the body to the brain, and those are called metastatic tumors. So gliomas will constitute about 25% of the brain tumors, and the malignant form is called a glioblastoma, and that's about 15% of the brain tumors overall. There's another kind that's benign that's very common, which is called a meningioma, and then other common tumors are in the pituitary gland or on the hearing nerves, so-called acoustic neuromas.
The Gerald J. Glasser Brain Tumor Center at Overlook Medical Center is leading the way with cutting-edge, state-of-the-art treatments and revolutionary modalities that are truly game changers in the battle against brain tumors. Precision medicine is customization of patient care, which includes immunotherapy, targeted therapy, gene therapy, and vaccine therapy. Overlook Medical Center also has a robust clinical trial program, a mission to bring dramatic change in patient outcomes.
We've seen the development of new treatments we call targeted treatments, which act upon specific switches inside those tumor cells that are targeting pathways that the cell is using to grow and divide. And the idea is that you can look at the DNA of the tumor and you can see what's making them tick and ultimately design a therapy. Gene therapy would be using something to put into the tumor that gets integrated into the DNA that then establishes that tumor suppressor gene again so it stops the cell from growing.
At Overlook Medical Center, neuropathology is part of a team approach to treating patients with brain tumors. Our role is to take the tissues that are given to us by surgeons and other doctors to examine them microscopically, sometimes to examine them genetically, and to make the correct diagnosis of what type of cancer the patient has.
No mouth sores or anything like that? Okay, good. And any dizziness?
Immunotherapy continues to gain momentum as a viable treatment. T cells are the body's defense against diseases. Cancer hides from T cells, so your immune system can't identify cancer cells the way it does other diseases. Immunotherapy uses drugs to help the body recognize cancer cells and then kill them. Overlook's neuroscience team is also utilizing vaccine therapy.
The person's own blood cells are removed and are exposed to either their own tumor or to a vaccine that's available, and the cells are then stimulated to react to that particular tumor, and then they're put back safely into the person where they can then activate the immune system to attack the tumor.
In addition to cutting-edge drug therapies, significant strides have been made with highly specialized surgical treatments, including skull-base surgery, endoscopic surgery, and awake surgery.
For the benign tumors, it might be something as simple as surgery, taking it out. For the more malignant tumors, often it's a combination of surgery, often followed by focused radiation on the tumor, and then medications. For most of the primary brain tumors would involve a chemotherapy drug, such as temozolomide.
To assist in the individual patient journey from diagnosis to treatment, the Gerald J. Glasser Brain Tumor Center at Overlook Medical Center uses a team approach, a multidisciplinary panel of experts, and a nurse navigation system.
There is a nurse who's responsible for helping the patient through those stages, smoothing the bumps, like getting tests done and trying to integrate it with their lifestyle. And the idea is to make it easier. There's no question we perform better as a team when we're planning treatment than as a single individual.